Welcome to Medicare 911. We are going to be talking about prescription drug plans and how to check your prescription drug plan. As you can see, we are on Medicare.gov's website. So we're at www.medicare.gov. We want to come right down here on this green button and click on Find Health and Drug Plans. Now, we are in June. So because we're in June, this is going to show us the results for the Medicare prescription drug plans for starting July 1st and the cost through the rest of the year. So we're going to click on Find Health and Drug Plans. And then right here, we're going to put in the zip code. So the zip code that I'm going to use for this particular individual is 33954. So whatever zip code you live in, just put in the zip code that you live in. The section down here, you do not have to fill out. I'm going to show you why in a minute. Up here, if you just put in the zip code, you do not have to put any personal information in there. And now we're going to hit Find Plans. So today we're going to be checking prescription drug plans for people that are on original Medicare. This part is optional. You do not have to fill out anything as far as do you have a separate Medicare drug plan or a Medigap policy? And then down below, right here, they're asking, do you get any extra help? So they're asking about Medicaid. And so for most people, you can click right down here that you do not receive extra help. And then we're going to hit continue. And then on this section right here, we're going to start entering the medications. So we're going to go down here. And now we're going to start entering the medications. Once you enter the first medication right here, right over here, it's going to bring up an ID number that in the future, when you get to this page, you can plug in the ID number and whatever your password date is. And then you hit Retrieve My Drug List, and it's going to bring up the list that you had put in on a previous day. So let's start by putting in some medications. I'm going to put in lisinopril. And for this example, I can choose lisinopril or lisinopril with hydrochlorothiazide. And then I'm going to put in the dosage. So I'm just going to change it to 2025. The quantity, they're taking 1 per day. And then this part I'm just going to leave because when we do the search, it's going to show us both retail pharmacy and mail order. And mail order will automatically default to 90-day supplies. And then down here, you do not need to change this medicine through a retail pharmacy. It's going to show us both mail order and retail pharmacy anyways. And then I'm going to add the medicine. So once I add the medicine, if you look over here on the right-hand side, you can see now that it's given me a ID number. And what you want to do is you want to write this down, not from my example, but when you put in your first medicine, write down the ID right away, because sometimes the website will all of a sudden stop, or if your computer starts having problems and you put in a bunch of medicines and you don't write the ID number down and the password date, you're not going to have any way of retrieving that information. You'll have to start over. And then also write down the zip code. And the important reason for writing down the zip code is you can come back in here if you move to a different area and you can update the zip code also. And I'll show you that in a minute. So now if we come down here, you'll see where we put in the first medicine. It tells us the quantity. Right now we're running it based on retail pharmacy because at the end it's going to show us both anyways. It will tell you if it's a generic or brand name. And then over here, if I wanted to change the dosage or remove, I just click on one of these buttons here. And then I can go in and I can change any of this and then click update. So now we're going to add in the second medication. Okay, enlodipine, Bisolate, and then it's 2.5 milligrams. And this is also 1 a day, so I'll leave everything else the same. And then make sure when you're doing this, you have your bottles with you, because when I put in some of these medicines, it brings up a few different variations for the same medicine. And then levothyroxine, 100 micrograms. Good, so I'll leave it there. And it's also 1 a day. I'm going to add the drug. Estradiol, so obviously this is going to be for a woman. So estradiol, so 0.5 milligrams, 0.5 milligrams. So I'll leave it at 1 a day. Meloxicam. So as you can see, once you get used to it, You only want to type in the first 3 or 4 letters, and it'll bring up the correct spelling of the name. If you try to type in everything and you get one letter wrong, it will not bring up anything. So it's just better just to type in a few and then add drugs. So like for instance, simvastatin. So I can just type in the first few letters and it's going to bring up the simvastatin and also a whole, so that way I don't have to type the wrong thing and then take a chance of misspelling something. So I'm going to put in, this one's 40 milligrams, 1 a day. If it was 2 a day, you put in 60. If a medicine was 3 a day, of course you could put in 90. But in this case, I'm just going to put in 1 a day and then add the medicines. And then I'm going to come down here and I'm going to check the medicines. Right up here, it's going to say the total number of drugs that I put on the list. And then I want to look at my list or count my bottles to make sure all that is the same. And then I want to scroll down and I want to look at my medicines to make sure everything's correct. Once I do that, once I verify all my medicines are correct, I can click on my drug list is complete. Then it's going to take me to the next page. On this page, depending on where you live, you may see a lot of pharmacies on the list, and then you'll see how big of an area it's showing you. So if I want to increase the area, so I'm going to increase the area to 9 miles, and then what I'm going to do is you can only put in 2 pharmacies at a time. So I know based on the area that we live in, what pharmacies have been coming out the best as far as the plans that work with those pharmacies. I'm going to start off with those 2. So right up here it shows 2 major pharmacies that are in the area, and you can only put in 2 at a time. So if I tried to add another pharmacy, it won't let me because I already have 2 pharmacies in. Once I do this and I get to the end, I'm going to come back in here and I'm going to add 2 more pharmacies just to make sure that out of the large pharmacies, which one is going to be the best one. And it's also a good idea to do that because you want to compare that perhaps to a local small pharmacy that you're going to. And sometimes your prices might be the same, but often the prices at the larger pharmacies could end up saving you quite a bit of money. So on this part right here, it's talking about refining your results. What that's saying is we want to look for, with original Medicare, we want to look at these prescription drugs. And in this area, it's saying there's approximately 20 different plans. If I click on these 2, it's going to show me Medicare Advantage plans. So I'm not going to do that today because I'm checking on prescriptions with original Medicare, and then I'm going to hit continue. And then up here, it says my plan results. I'm going to come down here and I'm going to skip past original Medicare because it's going to give you approximate cost. And then I'm going to come down here to where it says prescription drugs. And then it's saying right here, there's 20 different plans based on the zip code that I put in. And then the next thing it says, they're sorted by lowest remainder of the year cost, retail cost. So it's talking about retail pharmacy. So it's already telling me it's sorted by which drug plan based on Walmart and Walgreens. Based on those 2 pharmacies, what drug plan is going to save me the most money if I went to one of those 2 pharmacies. So the first drug plan that comes up, and this is not an endorsement of any particular drug plan, it's just based on a person's medicines and then what pharmacy. This particular drug plan is coming up as the least expensive. So you want to look at this number right here. This number right here, it talks about your cost as of today. So this would be assuming, because we're in June, that this plan would start July 1st. There's no way that I can change that. And my total out of pocket on these medicines would be $153 for the rest of the year, July through December. That includes this monthly premium times 6 months, any deductible that might apply. So if you see a $400 deductible, it doesn't mean you're going to have a $400 deductible on all your medicines. Sometimes it means that you're only going to have a $400 deductible on more expensive medicines, 3, 4, 5. And then these are my copays. So my copays are going to range, depending on the medicine, $0 for some, no copay. Some medicines might have a $27 copay, up to a percentage. Then the second best plan, so we go down to the next plan, it's saying that Humana Walmart is the second best plan based on these medicines, and my total out-of-pocket cost would be $174. That's for retail pharmacy. For mail order, on the ARP plan, it's saying it's $153 if I wanted to do mail order for the rest of the year. So that's July through December. So that number is the same as retail pharmacy. So as you can see in this case, there's not a difference in cost. It's not going to save me money. But if I go down to this one, Humana's remainder of the year costs for premium, co-pays, deductible, everything would be $134, which would save me $40 if I went to a retail pharmacy like Walmart or Sam's Club. Some of these companies partner up with pharmacies to give you the best deals they can. So Humana Walmart partnered with Walmart, Sam's Club, do mail order. Where this company up here, they partnered, so United Healthcare partnered with Walgreens to give you the best, to offer you the best prices. And then as we go down, WellCare is the third least expensive plan, but we're going from $134 and $153 right in there to $283 now. So if you don't do this each year, it's most likely you're not going to be on the right plan. So the next best plan, now we're at almost $300 out of pocket. Now we're over $300 on this one. And it's just based on the medicines. So you could run different medicines and SilverScript would come up best. Any one of these could come up best depending on what the medicines are. So let's go back up to the top. So with this particular person, let's say I already talked to them and they definitely, for some reason, either they do not want to go to Walgreens or they do not want to go to Walmart. They might say, well, Walgreens is next door to us. We would prefer to go there. So I'm going to click on this one because it's the best one for Walgreens. And like I said, this is not an endorsement of a company. And so when I look at this plan, now I'm going to see the details of the plan. So let's scroll down. So right here is the monthly premium, $22.50. There's no health plan with it. That would be a Medicare Advantage plan. And here's your deductible, $400. So here's the remainder cost for the year if that person went to Walgreens. Now the only reason why this number is so high is because this particular plan doesn't partner with Walmart. Okay, so this wouldn't actually be this high. But this would be the cost at Walgreens, and then this would be the cost for mail order for the whole rest of the year. Assuming that we started checking this plan in June, and it's showing us July through December. So then we go down here, we want to click on this tab for Walgreens, or we want to click on this tab for mail order to get our cost. So if we click on Walgreens, it's going to show us month by month, and look. So we want to look at how much our costs are before we meet the deductible. When we look down this column right here, we can see that the $400 deductible does not apply to these medicines because they're tier 1 or tier 2 medicines. So after the deductible, the initial coverage is the same as the coverage with the deductible. So we know that we're going to be paying a $0 copay for these medicines. This column over here is what the medicines cost, but that is not what I pay for them. All the medicines would cost $32, but what this person, or what I would pay if it was my medicines, I would pay $3 for a monthly supply. So if we look at mail order, we can see it defaulted everything from 1 month to 3 month supplies. So all the pills now are based on 90 pills, and here's my cost for all of them is $9, and it's because of this one medicine. If I got a 90-day supply, it would be $9, whether I still haven't met my deductible. And after I meet the deductible, I still pay $9 for a 90-day supply if I do mail order. So most likely with Walgreens, 90-day supply would also be $9. Then I want to scroll down here and it shows me a chart. So here's my cost. My cost for all my medicines, if I go to Walgreens each month, would be $26. $3 copay for the one medicine. All the other medicines are $0 copay. Part of this is my $22.50 a month premium. And so I can go across this graph and I can see that my costs are going to be $26, including my copays, for July through December. And then if I look at mail order, so in July, I order 90-day supply. That's $9 copay for the medicines, $22.50 for the premium. August and September, right down here, I would just pay my monthly premium of $22.50. Then when I get to October, I'm going to order another 90 days. So it's $22.50 plus $9 for a 90-day supply for all the medicine. Then I'm going to scroll down, and then right here it color codes each part of the graph. So I know that the gray is the monthly premium. I know that I'm still on my deductible, the orange, but in this case the deductible doesn't apply to tier 1 or tier 2 medicines. So green would be copays. So if I had already met my deductible, this would change color to green. The coverage gap is the donut hole. In this case, the medicines would not hit the donut hole. And the donut hole is the coverage gap. You start paying more for your medicines. And then you have catastrophic coverage, and that's when you come out of the donut hole and now the cost of your medicines drop down after you come out of the donut hole or the coverage gap. So then we go down here and we want to see if there's more information about the drugs. So we want to see if there's any restrictions on these drugs. Prior authorization, if we click on that. So prior authorization means that you or your prescriber must contact the drug plan to determine that if there's any specific criteria have to be met before you fill your prescriptions. So in other words, your doctor would have to fill out a piece of paper giving an explanation on why you're taking these medicines and have you taken anything else. So there's no prior authorizations on these medicines. There's only quantity limits. So the lisinopril and the simvastatin have quantity limits. So we're going to check to see. So we're going to check the quantity limits. So yes, there's quantity limits for these two medicines, lisinopril and simvastatin. And so the most that you can order would be 60 tablets per month, or 180 for a 90-day supply, or 30 tabs on the simvastatin per month, or 90 for a 90-day supply. This person is not over the quantity limit, so we're okay there. And then we're going to scroll down and we're going to take a look at the pharmacies that are in network. So we click on one network. It says one network pharmacy. We're going to click on that, and then we're going to increase this area. So when we go down this page, we'll see the pharmacies that are in network, and we can see that all these pharmacies say no. So they're not in network. And right here, it shows that only Walgreens is the only pharmacy in network. So now we check the pharmacies, so we want to make sure what pharmacies are in network. So right here, we'll see what tier the medicines are. So tier 1 is generally preferred generic. Tier 2 is generics. Tier 3 might be preferred brand names. Tier 4 would be brand names. And then tier 5 might be specialty drugs. But right here it tells us the tiers. So when we look at this on this particular drug plan, because they're all tier 1 and tier 2, the $400 deductible does not apply to these medicines. Then here's our list again. So if we're on this page, we can make changes to our medicines and take some away if we needed to. Let me go up. I'm going to go to the previous page. So right now I know based on my search, I put in Walgreens and Walmart as the two pharmacies, and these two drug plans came up the best. Now I'm going to go back up to the top, and I'm going to click on select pharmacies right up here. So I do not want to hit backspace. I just want to come up here and I want to go to this shortcut, and it's going to take me back to the pharmacies. Now, what I'm going to do is I'm going to remove Walgreens and Walmart as the pharmacies. And another thing is this, when you select the pharmacy, it doesn't matter which one as far as by street. All the Walgreens are going to be the same as far as price. So now I'm going to add in here, so in Southwest Florida, I put in Walmart, Walgreens. Now I'm going to add CVS and also Publix. So now I have CVS and Publix, and I'm going to check the cost on those plans. So I'm going to come over here and I'm going to hit continue. And then I'm going to make sure this is selected on prescription drug plans with original Medicare, and then I'm going to hit continue. Right here, something I didn't mention yet, if you see this letter N by the plan, it means it's national. So original Medicare, national. Then I come to the prescription drug plans again, so I can see that this one's national, this one's national. Now, because I took Walgreens out and I put in CVS and Publix, you can see now the drug plans that are showing up at the top at the first two is now Humana Walmart's the first one, not United Healthcare, ARP, Walgreens. And then the second best one is now WellCare, Classic are the top two. But look at the cost. So my cost for retail pharmacy has gone up from around $150 to $270. That's based on Publix and CVS. My mail order is still the same if I go through this plan. And then the second best one now, I'm from $150 something to $283 for Publix and CVS. And the mail order is $242. So now I know, based on the pharmacies, that Walgreens and Walmart or Sam's Club is going to save me the most money. And the reason why I said Sam's Club is because Walmart and Sam's Club is the same when it comes to the Humana Walmart drug plan. I don't want to spend that much. I want to keep my costs at around $150 or less. So then I go back up, go to this shortcut, select my pharmacies, and now I know what are the two pharmacies that are going to save me the most money, and then I'm going to put those back in. And so I'm looking for Walgreens, and remember, the street address doesn't matter. The costs are going to be the same. So I'm just going to add Walgreens in there, and then I'm going to go to Walmart. So you can see there's all these different Walmarts. I'm just going to add one, and then I'm going to go back up so I can see my two pharmacies I put in there. And then I'm going to hit over here, continue to plan results. And then I'm going to make sure I have this checkbox checked off, prescription drug plans with original Medicare. And then, by the way, you do not need to mess with all these things over here, okay? It's just going to mess up your searches. I'm going to hit continue. And then now I can make a decision. Do I want to go to Walgreens and pay $153? That includes my monthly premium and my co-pays and everything for the rest of the year. Or do I want to go to Walmart and pay $174 for the rest of the year? Or do mail order and pay $134 the rest of the year? Which also, this one also, they all include the monthly premium if the deductible applies and co-pays. Now, the last thing that you want to check is, so right here it's going to tell you, are all my medicines from my list covered on this plan? Yes. Are there drug restrictions? Well, we already checked this one. We know there's quantity limits on this particular drug plan. All my medicines, what I take per day, are below their drug restrictions, so I'm fine as far as quantity limits. And this plan's also national. So the other thing that I want to look at is this over here. So you'll notice 3 out of 5 stars, 3 out of 5 stars, 2.5 out of 5. This one's 3.5 out of 5. But sometimes people do their searches based on overall star rating, but why do I want to pay $300 for my medicines for the rest of the year, $150 more, just because of a star rating, when I could pay $153 for the rest of the year? So just be careful how you do these searches. So you can come up here, and let's say I want to look at the drug plans that have the lowest remainder of the year mail order cost. I can hit sort, and it's going to sort them by which one's going to save me the most money if I do mail order. We're at Humana Walmart. It came up first, $134. and then Walgreens $153. So now they're sorted based on mail order cost, and then it's going to get more expensive as they go down. My recommendation to you is when you do your search, just do it based on these two. If the medicines are not covered in the plan, most likely they're not going to come up as the least expensive plan. You know, you can fiddle around with this and play with it, but just make sure when you do your final search, you do it by lowest remainder of the year retail cost and also lowest remainder of the year mail order cost. The last thing is this. So let's say a person, we check the medicines based on a 33954 zip code. So let's say, for instance, particular client, they live up north also. We want to be able to check those medicines in a different zip code. To check the drug plans in a different area, we're going to go back to select your pharmacies. And then when we go back to select your pharmacies, we're going to search a new location, because right now it's doing searches based on 33954. And so now we're going to look, for instance, we're going to check out the zip code for 18914. So that's up in Pennsylvania, and then I'm going to hit update. And now it's going to show us the pharmacies. Let's increase the distance. So now it's going to show us the pharmacies based on the zip code I put in on 18914. And then I'm going to scroll down, and I want to check to see if any of those pharmacies are available that we had put in, Walmart and Walgreens, are available close to this zip code. Third page. So here's Walgreens and here's Walmart. So I know there's Walgreens and Walmarts in those areas as well, because some people might have homes up north and then also homes down here. So it's important that you check that to make sure that your plans are going to be covered in both areas. And that's about it. If you have any question for us, please give us a call. And I hope this is helpful on how to check your prescription drug plan with Original Medicare.